Hello, my name is Ron Eslinger. I'm a retired Navy captain, certified registered nurse, advanced practice nurse, and a certified master hypnotherapist instructor. I want to introduce you to our two-day program in pain management. I first got interested in pain management as a CRNA and have used it since 1978 as a part of my hypnotherapy practice. I was lucky enough that in 1996 to start working in a pain clinic where one day a week for 8 hours I saw chronic pain patients. I have worked with chronic pain patients using hypnotherapy ever since that time on a regular basis, and now that is the baseline for my hypnotherapy practice. So let me introduce you to some of the parts of this program. And what makes this program unique is in the fact that it works not only on the psychology of hypnosis, but both on the biology and the physiology of hypnosis. The question is who should take this course? I feel like that anybody who is working within the realms of healthcare should know something about how to talk to patients and how to use hypnotic language in patient care. That is all included within this course. For non-hypnotists, it has an introduction on hypnosis and how to use hypnosis and how to hypnotize. For the hypnotherapist, it's advanced in its processes of how to introduce a person to the biochemical physiological responses that hypnosis creates through a part of the brain we'll discuss later, the limbic system. The first thing in working with patients that have chronic pain is to help them change their perception of who they are and to quit living today as if it was yesterday. We have to bring them into the present and let go of the emotions that trigger a lot of the responses that they're having today as they see themselves as victimized by their pain. We'll study the why and how of hypnotic techniques that change the mind, for there is no pain until it gets to the brain. So therefore, if we can help a person, again, change the mind to change the brain, that will change the pain. Hypnosis is evidence-based and a proven method to create change in a person's pain. We want to discuss how the pain mechanism works. We won't spend a lot of detail here because this is actually a part of the course, but this would be the first step in looking at where the pain originates and then the fact that it goes to a place in the spinal cord called the dorsal horn ganglion. At that point, it gets interpreted and then sent to the brain, where the brain then, again, takes that interpretation and determines how it's going to deal with that pain. Sometimes the wrong interpretation is made and the wrong signal is sent back by the brain. So we'll talk later in the course about exactly what can we do then to change what moves from the peripheral side into the dorsal horn ganglion and then change that interpretation to create that pain loop. And those are things that are definitely a part of the course. What I have found that most people kind of miss the boat in working with pain management in the fact that they do not do the right and a proper pre-pain evaluation in order to know exactly what this person would respond to. We determine in this about hypnotic language, hypnotic techniques. We study metaphors. We do look at secondary gain. We look at cell memory. We do age regression and age progression. We'll also talk about the degrees of sleep and how sleep affects chronic pain and acute pain. We'll talk about distraction, displacement, dissociation, and other hypnotic procedures that have to do in mindfulness training and working with pain. What we want to do is create a very favorable, happy relationship with that client from rapport all the way down. Those are the areas that when a hypnotist becomes very precise at, very learned at, and knowledgeable in, there's no pain that you can't work with a major degree of success. We teach this program live. We teach this program on a home study course. We invite you to visit our website, www.eslinger.net, or you can call us at 865-269-4616 for information on getting continuing education credits for this program, or also we offer a certification for this program. You will be able to help others who in the past have not been able to help themselves. Thank you.